Like most big cities in North America, Toronto has a high incidence of injection drug use. Heroin, methamphetamine, cocaine, and prescription opioids are all popular drugs which can be injected. According to Health Canada, 7% of all people living in this city struggle with substance abuse. It's estimated that drug abuse-related illness accounts for over $1 billion in Canadian healthcare costs each year. Public health officials have known about this problem for a long time, and as such there are currently 50 sites across the city which distribute clean supplies to users. Unfortunately, this hasn't done enough to stop the rising death toll due to injection-related overdose. In 2014, 258 people died from drug overdose in Toronto. That is the highest annual number ever recorded in the city, and it represents a 40% increase over the previous decade. This is why, as of Thursday, July 14, 2016, Toronto City Council has approved the opening of 3 supervised injection sites across the city. If granted approval by the federal government, the sites will open as soon as the end of this year.
How do you feel about safe injection sites near your home? That's a place for intravenous drug users to shoot up. It could happen. In fact, the city's top health official is leading the charge tonight.
3 health services: Toronto Public Health through its harm reduction program, The Works, on the ground floor of this building, Queen West Central Toronto Community Health Centre, and South Riverdale Community Health Centre are all planning to add small-scale supervised injection services to their existing clinical health services for people who inject drugs.
Of the 3 sites proposed by Public Health, one is of extreme historical importance. The Works was the first needle exchange to open in Toronto, and it ushered in a new era of harm reduction in the city.
On a typical day, the councillors might meet as many as 50 people and exchange some 30 needles. They also distribute free condoms and needle cleaning kits. Fred Ruff manages Toronto's needle exchange.
We are in the business of AIDS prevention, and the injection drug user is at extremely high risk. It's a direct blood-to-blood transmission of the AIDS virus if a person is infected.
The Works is the epicenter of Public Health's harm reduction model, which not only distributes clean supplies to users at the 50 sites across the city, but also educates users about healthcare, housing, treatment programs, and other important services which they may be in desperate need of. Coincidentally, the Works is located just a block away from Toronto Film School on the corner of Dundas and Victoria, where it's been serving the community for the past 15 years. I had the chance to speak with Patrick Shaw, a longtime employee at the centre.
My name is Patrick Shaw. I work as a counsellor at Toronto Public Health, The Works.
Pat has been with the centre from the very beginning.
We're a harm reduction centre. Provides tools, information, counselling, outreach for everything to do with harm reduction.
In order for the sites to open, a legal exemption from the federal government is required.
But I think that one of the catalysts of actually putting in an exemption application and following through is the fact that the government changed.
Okay, what am I going to do to stop legalization of marijuana? First of all, I'm not going to stop legalization of marijuana. I'm going to do it. And the reason is very simple. The current approach, the current prohibition that Mr. Harper is continuing to push doesn't work.
The Conservative government under, what's his name, Harper, unfortunately was a bit anti-drug. In fact, it changed Canada's drug strategy to Canada's anti-drug strategy as a title. And I think that told us all we needed to know.
Now, I know some people say if you just legalized it, you'd get the money and all would be well. But I think that rests on the assumption that somehow drugs are bad because they're illegal. The reason it's not that. The reason drugs are illegal is because they are bad.
But also there was a number of court cases, sort of him trying to shut down Insight in Vancouver.
Insight is a supervised injection site which opened in Vancouver in 2003. It was the first injection site to ever open in North America, and it will serve as the model for the sites set to open here in Toronto.
There's a waiting room You basically wait until your name is called, and then they take you into the injection room, and there's basically voting booths that are stainless steel. You do your business. They have people there that can help you if you're having troubles, people there to do basically whatever it needs to help keep you safe and alive.
Supervised injection site services serve the community in 5 main ways: reducing overdoses and deaths, preventing the spread of infectious disease, providing access to detox and drug treatment services, connecting people with other health and social services, and by reducing the number of publicly discarded needles.
The need is clear. Preventing overdose must be the top public health priority of our city. 206 people died in 2013 due to overdose. 206 people.
A recent study of clients of the works found that almost a third had experienced an opioid overdose within the past 6 months, and about 36% reported injecting in public places such as washrooms and alleys.
I've watched them respond to overdoses outside 10 times faster than any ambulance or emergency worker could get to them. So they're not only saving people in Insight, they're saving people within like a block-and-a-half radius of Insight.
Being in the alley, they're always looking over their shoulder. They're not sure who's around, how safe it is. They rush and they do things that they wouldn't normally do. And as a result of that, they misjudge how much they inject and they can overdose. And if they're by themselves, most likely they'll die at that site.
At the time in 2003, we had really high levels of HIV transmission and also hepatitis C. We actually had sort of close to third world rates.
In an extremely dangerous practice, many pick up and use needles that have been discarded.
There's a good possibility it was used by somebody with a bloodborne illness, HIV, AIDS, hepatitis C.
They use contaminated water from puddles.
Many people have open wounds that are open for a year and a half. That results in skin grafting, so they have to go up to plastic surgery. It's specialists. Even then it doesn't heal properly, and then they need amputations. So when you add it all up, it's a huge cost to our system.
It's really important as a healthcare clinic, providing overdose response for people down here, preventing the spread of HIV, getting people to treatment, and it's also really important in terms of building relationships with people who are really marginalized in this society. They don't access healthcare easily. They go to emergency rooms, they go to clinics, and sometimes the experience isn't very good, and what that does is that makes them sort of shy away from healthcare. But healthcare for people who are addicted is really, really important. It's really important that they be around nurses all the time, that they be around things like running water and clean equipment and oxygen tanks if they OD.
Here's the thing that people forget about safe injection sites is, generally speaking, if you've never dealt with a professional in your whole life and you think, wow, maybe I should, I'm in the neighborhood, I'm going to go use their safe injection site. So then they meet Patrick, or they meet, Ruth, or they meet someone else who works here, and they develop a relationship. And that's where people go, oh, can I get on methadone? Oh, you know what, I'm tired of injecting, can I do something else? And that's where we have real conversations with folks. And that's where probably 10 or 15% of the people that I deal with in a year ask me for a referral to drug treatment. So in fact, we're sort of providing them with a professional for other resources as well. Oh, you have no housing? Oh, we can help you with that. Here's a phone number, here's a place you can go, here's a housing worker. Food banks, so many other issues will come up only because they came to safely inject here. So I think that that's a piece that people forget, that a lot of people go to treatment after developing a relationship with us.
Like most issues which revolve around drugs, supervised injection sites are controversial in nature. Even though they've been proven to save tax dollars, there are still those who are unsure about having these sites in their communities.
The thing I find with the injection sites per se is I don't think it's really harm reduction anymore. I think it just goes into enabling and just harm, because they're not necessarily giving you just the things to be safe and then it's really up to you. They're actually saying, okay, come here, you can inject, here's a safe place to go. And it's more just I feel like it's promoting harm almost, because it's saying, okay, come here, you're safe, you can use, and there will be no consequences.
But despite any objections which have been raised, Toronto Public Health are sticking to science and fact and are continuing to move ahead with their plan. If the federal exemption is granted this fall, Toronto will soon have 3 new supervised injection sites operating within months.
In more than 90 sites around the world and in Canada, supervised injection services work. They work well. They improve the health of those who use drugs, and they improve the safety of the surrounding community. It is time for the City of Toronto to act. We can and we must.